Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about the Mental Health Access Improvement Act. This was approved or signed into law in December of 2022 by the President, and it is allowing or expanding services for mental health to be actually reimbursed and paid for by insurance companies, specifically Medicare, when mental health counselors and marriage and family therapists actually provide services. So I'm not sure if you are aware, you probably are if you're in the behavioral health field, but until this got passed, mental health counselors, or MHCs, and MFTs, marriage family therapists, I believe that is their abbreviation, were not able to bill Medicare for services rendered when they counseled and saw patients with Medicare insurance. So those patients either had to be cash price or they couldn't see those patients at all. Through a lot of advocacy programs in the behavioral health field with all of their professional programs and associations, they have finally broken through, and these services starting in 2024 will be paid by Medicare. And this is huge because, you know, the whole behavioral health field has been growing in general, and I believe a lot of the stigma behind people receiving mental health and behavioral health services is dwindling a bit. It depends, but because people are so pro services when it comes to behavioral health, this really helps in that fight of getting people who need help the help they need. And it's very exciting. Of course, there's certain parameters and requirements in order to be considered the counselor to bill for these services, but they're very basic. I will put a link in the description of the video of some FAQs about this, and so if you're interested, you can definitely check that out. I would definitely follow whatever kind of professional organization you're affiliated with too, because they're going to have more and more information as this year goes on. Right now, HHS and Medicare, they're working on all of the requirements on how to become contracted with Medicare and the requirements and the applications that need to be completed. So you can't do it yet, but I'm guessing probably by June, July, August, they're going to have to release that because they're going to be receiving a lot of applications, and for them to be able to be live and start billing services as of January 1, 2024, those are going to have to be processed and approved by that time. So basically, you have to be a mental health counselor, and you can also be a clinical professional counselor or just a professional counselor. And you have to have a master's or doctorate degree in one of those specific fields or titles. And you have to have at least 2 years of supervisory counseling before you can apply to bill services on your own. So there is some requirements there, but they seem very reasonable, and it's very exciting. This is huge for people who are just trying to help as many patients as they can, and they'll be able to get reimbursed. Now, Medicare Part B does already cover mental health services by, services rendered by a psychiatrist, psychologist, a social worker, but they have to be certified, of course. I'm trying to think if there's another one. Oh, I'm sorry, a mental health nurse practitioner, nurse. So they are already covering certain mental health services, addiction services, but this just broadens more people who can get help and practitioners who can provide those services to those people. So I just wanted to put it out there. This is very exciting news. If this is something that affects you and you have more information that you want other people to be aware about, please put that in the comments below. And also, I want everybody to be aware that even if you're not in behavioral health specifically with your specialty, chances are you're going to be seeing patients who are going to be needing mental health services. And it is always good to know what your options are. And so this will definitely broaden more people's abilities to be seen sooner, because there's such wait lists right now with the providers out there giving mental health services. And so even though, like I said, this isn't maybe your specialty, it's good to know this because it's going to allow you to refer patients to more options, different kinds of practitioners in mental health. So keep that in mind. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. Thanks so much, you guys. Take care. We'll talk to you soon. Bye-bye.